have a situation where the government is going to decide everything. The money will go from the taxpayer into the government and then into this new thing that they're going to create. And then they will give the money to the provider. Well, where does the customer come in all of this? There isn't. There's no connection between the customer and the delivery of the service. And that is something that in Canada has caused us endless grief, and it will cause you it as well. And undercapitalization. We have got terrible access to technology, as I pointed out to you, and one of the reasons is that the decision to buy an MRI machine has to go up against the decision to build a new bridge, to build a road in the constituents in the riding of the Minister of Health. Who's going to win? Some airy-fairy plan to buy an MRI machine, or the very practical politics of solving the ward problem? Don't put your health care funding capitalization decisions in the hands of politicians, ladies and gentlemen. That's the number one thing you can learn from Canada. Don't do it. They'll do as they did in Saskatchewan. They'll build hospitals in every square mile of the place as long as they'll buy them votes, and then they won't fund them. They can't. They won't have the money. So these things will be edifices all around. Recently in Saskatchewan, they closed thousands of hospital beds. Finally, when they said, you know what, this is all a myth and a charade. We can't have a bypass surgery center in every town of 400 people. Right? But that's what they did. They built all these hospitals and then couldn't do it. And it was actually unsafe for people because they had hospitals where people were trying to do things where they shouldn't have been. You know? I mean, if they had to put a shingle out, you know, George's General Surgery, you know, carbuncles to cardiac care, you know, I mean, it wouldn't, but that's what happens when you have these small hospitals where people, you know, jack of all trades, the physician doing all this different kind of stuff. You shouldn't be doing that. So it's not good for your health, and it's certainly not good to let the government get in and capitalize things. Okay. Canadian system is not the one to copy. I'm very nearly finished now. But what should be done? Let's consider the recommendations of the Blue Ribbon Panel. Universal health insurance should be universal. I agree, absolutely. Health care insurance must be legislated, that is to say, not optional for residents. I agree. Why do I agree with that as a libertarian by sort of gut instinct? Why do I agree that there should be compulsion with regard to health care? The reason I agree that there should be compulsion with regard to health insurance is that we are, as a society, not prepared. We're not prepared to say, if you don't buy your health insurance, tough luck. We are always, and it's quite appropriate, we're always going to help. We're always going to be the Good Samaritan. But on the financial side of the Good Samaritan is what? Is the robber baron. The person who deliberately says, well, I'm not going to pay insurance because I know they're going to help me when I need it. And then who pays for it? All of the other people who buy insurance. So the only way to do it properly is to make it universal so that everybody has to pay for the care. Because that's the way in which we're going to behave when the care is needed. Now, national health insurance should be administered by the National Insurance Board. This is not okay. It is not okay. The Commission itself noted that the National Insurance Bureau is hopelessly inefficient, 25% overstaffed. And they apparently think that this is coincidental, because they go on to say that the inefficiencies of the NIB will have to be dealt with. Well, of course that's true, but how are they going to be dealt with? How did they get there in the first place? No discussion of this. Was it just a mistake? No, it was absolutely deliberate that when people are given a monopoly, that's the way in which they behave. The evidence on this is profound and it's pervasive, and there shouldn't be any question about it. So the idea that this NIB is going to solve your health insurance problem in the Bahamas is nonsense. They're going to blow a lot of dough, and they're not going to provide you with what you want. So don't go that way. The Commission doesn't question the central planning model and the hidden costs of monopoly. What are some of the hidden costs of monopoly? If I said to you, you know, all of this expensive, because they make a lot of comment about this in the paper, they note the study from Harvard that, you know, if you have a national single-payer system, you can reduce your cost of administration. Now, let's suppose we were talking about breakfast cereal. Would anybody in this room, or indeed anybody in the Bahamas, vote for a politician who said, we need to have one supplier of breakfast cereal because that way we'll reduce the cost and improve the quality? Now, who would vote for such an idiot? Nobody. Everybody knows that you couldn't have one supplier of breakfast cereal. For one thing, people have different tastes in breakfast cereals. And they would immediately think, would they want to eliminate my, whatever it is that they eat, their, I've forgotten, I don't eat breakfast cereals, so I don't know what the names are, but, my Raisin Bran, yeah. Would they want to eliminate my Raisin Bran? So they would, they would be skeptical about it. Now, if you said, we got a lot of inefficiency of the automobiles. We got a Chrysler dealer, we got a Ford dealer, we got a Volkswagen dealer, we got a Volvo dealer, we got a Mercedes dealer. Imagine all the paperwork that goes into administering all of those different competing suppliers of automobiles, right? We could save a lot of administrative cost by just having one producer of automobiles. Nobody takes that kind of crap seriously anymore. The Blue Ribbon Commission did. The Blue Ribbon Commission said that if we can eliminate all of this competition, we can save costs. And look at the Canadian system. The Canadian system only costs 1%